to our 2023-2024 webinar series. And we are starting, as you know, with the primary financial assistance programs for the Fabry community. So our first speaker is from the PAN Foundation, Amy Niles. And first, I'll introduce you to Casey McKenna. Casey McKenna is a senior program manager for the National Fabry Disease Foundation. And from this point, Casey is going to introduce Amy and then turn the screen over to Amy so she can share her slides. And Casey will also be managing questions that you have. If you put your questions in the chat box, when we get to that point, Casey will address the questions with Amy. And so write them down while the presentation is being held so that you can remember them when it comes time. Then at the end, we will do a couple of prize drawings. And the prize drawings, I'll repeat this later, but the prize drawings are, one is for primary attendees, either people with Fabry disease, family members, or caregivers. And the second one is for anyone that has completed our December 2022 patient-reported outcome survey. And that survey will remain open through the end of the year. So with that, welcome to Casey. You're up.
Great. Thanks so much, Jerry. Again, my name is Casey McKenna. I'm a new face at the National Fabry Disease Foundation, and I'm happy to be here. And to introduce Amy Niles. Amy is the Chief Advocacy and Engagement Officer at the PAN Foundation. She leads the organization's relationships and partnerships with the patient advocacy and healthcare provider communities while overseeing public policy and advocacy initiatives. And she's here to talk about financial resources that are available for individuals and families with Fabry disease. Welcome, Amy.
Thank you so much, Casey, and thank you, Jerry, and thank you to the National Fabry Disease Association for inviting me to speak with you this evening or this afternoon, depending on where you are calling in from.
Well, welcome, Amy. Brittany, could you put Amy on full screen, please?
Can everyone see my slides? All good? Okay. Well, again, thank you for inviting me to speak with you this evening. It really is an honor to speak to you and do really important work side by side with the National Fabry Disease Association, or Foundation, I apologize. So in the next half hour, 45 minutes, we're going to cover a lot of ground. I'm going to share some information with you about the PAN Foundation, and I know some of you may already be familiar with the work of our foundation. I'll share with you information about the various disease funds for which we offer assistance, talk a little bit about advocacy and education, health equity, and ways that you can stay connected. So we're going to cover a lot of ground today. The PAN Foundation is a national patient advocacy organization. We are an independent charitable foundation. And at the core of what we do is we provide financial assistance to people who are underinsured. We do that by providing financial assistance to cover their out-of-pocket costs for prescription medications. While we are providing this extremely important safety net, we are also advocating for improved access and affordability. We've been around for 2 decades now, and since that time, we have helped, it's actually more than 1.1 million individuals who are underinsured. We have provided more than $4 billion in financial assistance. It's a big number. And today we offer assistance in more than 70 different disease funds. Our reach is very, very broad. As you can see here on the map, we provide grants to individuals living in every single state and every single territory. The states that you see here in dark green are the ones where we have provided the most number of grants: Florida, Texas, and California. Our reach is broad. In 2022, last year, we provided more than $325 million in financial assistance, and that's across all of our 70 disease funds. We provided more than 169,000 grants, and we know these grants were critically important to people who are underinsured. it probably made a difference in terms of their ability to start treatment and to stay on treatment. Since we've been around, we've answered more than 4.5 million calls from individuals and healthcare providers, all relating to patient assistance. In our call center, we can support patients across 23 different languages. And you see in the middle, 52%, we know that once we provide a grant for financial assistance, as I just said, it makes the world of difference in terms of someone's ability to stay and adhere on treatment. And these statistics just bear it out. We do annual surveys of our patient population, and we know that once receiving a grant from the PAN Foundation, people are less apt to skip doses or cut pills in half. They're less apt to walk away from the pharmacy counter because they can't afford their medications. And one statistic that is very telling, and I always like to share it, it's not a good statistic, but today 1 out of every 3 Americans walk away from the pharmacy counter because they can't afford their out-of-pocket costs. So a little bit about the assistance that we provide at PAN. As I said, we cover around 70 different disease funds and programs. Many of them are in oncology, chronic diseases, and rare diseases. Most of the assistance that we provide is off to the left in that left box. It covers medication copays, deductibles, and coinsurance. We do have a handful of programs where we provide assistance for health insurance premiums. And a great benefit to being enrolled in one of our programs is our transportation program. And I'll speak a little bit about that in a moment. So here in very small print is just a listing of all of our disease areas, and all of this you'll find on our website, which is panfoundation.org. We are continually looking at new disease areas where we know there is a need for financial support. In fact, we have a very long list of maybe up to 300 additional disease areas that we'd love to provide support for. We just need some donations to help us do so. So a little bit about what we call our fund statuses. And again, some of you may be familiar with this terminology because perhaps you've been to our website. You'll find on our website that some programs are open, some programs are closed, and some are open to the wait list. If you see that a program is opened, that means we have funding in hand and we can give out grants to people who apply and meet our eligibility criteria. If a program is closed, it means our funding has run out. We're searching for more funding so that we can reopen that program. When our programs are closed, we highly encourage patients to add their names to our wait list. And I'll go over the wait list in a little bit more detail, but that is really important because when we are able to reopen that program, we will reopen it first to those individuals who have added their names to the wait list. So a little bit about our PAN grants. Our assistance amounts vary based on the disease, and we try to identify the amount that really equates to the average out-of-pocket treatment costs for that particular disease. We have actuarial consultants who help us with this work every year. Our PAN grants cover a 12-month period. It is a rolling 12-month period, so it's not a calendar year. And what's nice is that, let's say today someone would apply for assistance and receive a grant. We'll also cover their out-of-pocket costs for the 3 months prior to today's date. We have a policy that encourages all to really use their grant amount. And if they have not used their grant amount in a 3-month period, we're going to reach out to you to see if there's a reason that you haven't. or to see if perhaps you no longer need that assistance, because we want to make sure that the resources we have are going to the individuals who need the assistance the most. And as you may know, once the 12-month period ends, there is an opportunity to renew your application for another year. So what do we cover? We cover the out-of-pocket costs for all prescription medications. That includes generics, bioequivalent drugs, all medications that are FDA approved or listed in official compendia or published evidence-based guidelines. What we don't cover, unfortunately, are the costs associated with medical services. For example, copays associated with when you go to visit your healthcare provider or lab work. We do not cover products that are not covered by insurance or paid at 100%. So we think of PAN as really the payer of last resort. And we don't provide assistance with products that are billed only to discount cards. So for example, if you're seeking assistance from a card that's provided directly from a manufacturer. So let's turn to the Fabry Disease Fund specifically, and that grant amount, and as you just heard, it's designed to meet the average out-of-pocket cost for someone living with this disease is $8,700 for a 12-month period. To be eligible to receive a grant, you must be treated for the disease. You're residing or receiving treatment in the United States or one of its territories, and we do not require citizenship. You have health insurance that covers your medication or product. So at PAN, some of our disease programs are only for Medicare beneficiaries, while other disease programs, such as this one, is really for anyone with health insurance. So you can have Medicare or you can have commercial insurance. You have been prescribed a medication or product that's listed on our list of covered medications, also called a formulary. And when you go to the PAN website, you will see all the medications that are covered for this disease. And finally, the last eligibility criteria relates to income that falls at or below 500% of the federal poverty level. I always like to give an explanation of that because very few people know what that would equate to in terms of household income. So for a family of two, if you were at 500% of the federal poverty level, you would have income that's close to around $99,000. For example, for a family of four, that would be an income of about $150,000 or less. When we look at the patients that we are providing support for, we see that most of the patients we are helping are at the lower end of the federal poverty level. So we know that we're helping the people who truly need this assistance the most. I mentioned a few moments ago that for a handful of our programs, we also provide premium assistance. And this is one of those disease areas where we do this. And for Fabry disease premium, the funding amount is $4,500 per year. You can see here that the eligibility criteria for this program resembles that for Fabry disease as well. So our transportation program is for individuals who are enrolled in our programs. We think it's critically important that people be able to travel to their healthcare provider or be able to travel to their pharmacy to pick up a prescription, or even travel to a grocery store so they can buy food to put on their table. So we developed the transportation program several years ago. It is a $500 grant over a 12-month period. And we have this program is listed on our website as well. And you can determine the eligibility criteria. You can see the eligibility criteria for this program. So What I'm going to walk through now are just the very easy steps that patients and providers, because many times providers, whether they be the physicians or pharmacy staff, may be applying on behalf of the patients. But I'll walk through the very easy steps that one would go through to apply for assistance. The first step is really just to determine if the fund is open. And you can do so very easily by visiting the PAN Foundation website, panfoundation.org. We encourage patients to set up their own PAN portal account, which is very easy. And it's a great way, once you have a grant, to manage that grant and determine how much of the grant you have used at any particular time. We also have a call center with about 70 individuals or so eager to answer any questions you might have, or to help you enroll in the program, because we know for many people, they don't like doing this online and they would prefer calling us, and that is perfectly fine. Our toll-free number is 866-316-7263. So once you've determined that a program is open and can provide funding, you'll review your eligibility criteria. And that is the eligibility criteria we just reviewed with you. And you have to have met all 5 eligibility criteria, not, for example, 4 out of 5, but all 5 criteria needs to be met. You can begin this process directly from our homepage. We have a great eligibility tool where you can simply input the disease or the medication you're seeking and start walking through the application process step by step. We'll gather some information from you, your basic demographics, the diagnosis, the medication that you're seeking assistance for. We'll need your information because, again, we want to make sure you have insurance, and that will be the payer of last resort. And we'll ask you information about your income. Up front, we will not ask for any income statements. And we'll ask for your healthcare provider information. And then once we have that, you're ready to submit the application directly from our website, or simply once you have responded to these questions at our call center, they will be reviewing your application. And that process takes minutes. And once you have met the eligibility criteria, you are approved. So within minutes, you are approved, and you can take the ID number that we provide to you directly to the pharmacy counter and use it right away. You will get your PAN ID, it's like a little insurance card, in the mail within about 2 weeks. So it's a very easy process. We have made the process easy and quick for a reason. We know that people need their medications, need to begin treatment as soon as possible. So we try to remove as many barriers as possible. Off to the left, just a couple of notes. One is that on the back end at PAN, we're doing what's called a real-time income verification through Experian. And that's just our way of taking the information that you have provided to us about your income and seeing if there's any disconnects based on your demographics. It is a extremely very small minority of patients where there is some disconnect. And when that happens, we will ask for additional verification from you and documentation regarding your income. But for the most part, the overwhelming majority of patients do not go through that process. And once you're approved, all of that grant funding is available to you for that 12-month period. So how do you submit expenses to PAN once you have incurred the out-of-pocket costs? On this slide, we describe the very easy process that either pharmacy staff or providers or patients themselves can use to submit their expenses. And for patients, oftentimes they're submitting their costs to us directly using a direct member reimbursement form, which is included on our website. And once we have that form and we review it and everything looks okay, we issue a check to you within about 10 business days. We have several tools that one can use on our website. And this tool is one for submitting claims and provides information about what I just shared with you, how to submit your expenses to us so that you can be reimbursed for those costs. We also have a tool to help you apply and manage your grants. As I said earlier, you can set up your own portal to do this on your own. You don't need to, but it's a nice tool and it's a great way to see how your grant is progressing from one month to the next. And as I shared earlier, checking patient eligibility, walking through the application process, you can start this right on our homepage at panfoundation.org. And find a disease fund. We have an alphabetical listing of all of our disease funds, so you can click on any letter and see what disease areas we provide assistance for, and you will also see which programs are open and which are closed. We've talked about the PAN portals, and again, patients can set up their own portals. We know that providers, healthcare, the physicians, other healthcare providers, pharmacy staff like to set up their own portals because it is a great way for them to manage the grants of their patients and also receive reimbursement electronically. So just a little bit of information about our wait list. I'd like to go over this in detail because it is very, very important. We don't want anyone getting discouraged when they go to our website and they see a program is closed. It is very common, not only at PAN, but at other charitable foundations, for disease funds to open and close several times during the year. That is the nature of how we operate. So again, if a program is closed, we encourage patients to add their names to our wait list. So that's the second item here, provide patient information to sign up for the wait list. We'll confirm, once you do that, we'll confirm that we have received your request to be added to the wait list. When the wait list opens, which means that the program now has funding and we can provide grants, we're going to open it up first to the wait list. You'll be notified and you can apply either online or by calling us at our call center. We do have a limit. You have 48 hours or 2 days to apply for that assistance. If you don't get a grant, you'll remain on the wait list. So you'll just, move up higher on the wait list. Sometimes when we get funding, we're able to go through our entire wait list and then open it back up to the public. Sometimes we're only able to go through some of the wait list, which is unfortunate. But when that happens, those that have not received a grant that round will move up to, further up to the top of that wait list. We also provide referrals to other charitable foundations or even pharmaceutical manufacturers. At the end of the day, we want everyone to get the assistance and find the assistance they need. So we really do not care if that assistance comes from PAN. We just care that the patient can find the assistance they need, whether it's from PAN, another charitable foundation, or another program. I want to spend just a moment talking about Fund Finder because this is a very important tool that we developed now about 4 years ago. There are 9 national organizations that provide copay assistance. There are 6 independent charitable foundations, like the Pan Foundation, and then there are 3 other organizations, for example, Cancer Care or the Leukemia and Lymphoma Society, that do a lot of things, but they do have an arm of their organization that provides copay assistance. Collectively, all 9 organizations offer copay assistance across 200 disease funds. Imagine how difficult it is really for anyone to keep track of who is out there providing assistance, what programs are open, what programs are closed. There's an awful lot of time that can be spent calling foundations or visiting websites. So about 4 years ago, we spearheaded fundfinder.org, which is a web app that through technology brings together all of these programs in one place. So if you were to register for FundFinder, and you can easily do so at fundfinder.org, you would find that you can easily see all of the patient assistance programs offered by the 9 charitable foundations. Here's the beauty of FundFinder, whether it be for Fabry or any disease. As you may know, sometimes for a particular disease, there are multiple foundations or organizations providing copay assistance. So if you register for FundFinder and you say you are interested in Fabry or interested in asthma or another disease, you'll see who those foundations are. Here's another great feature of FundFinder. Let's just say, I'm going to use asthma as an easy example because I know for asthma, there are 4 or 5 charities that provide assistance for that disease. And let's say today, for argument's sake, we are all closed. We have no funding to give out for asthma. But tomorrow, let's say Pan receives funding and we're able to open the grant process up. Tomorrow, if you had expressed interest in asthma, you would receive an email alert or a text alert saying Pan is open, and that would prompt you to go pretty quickly to our website or call us to start the application process. So FundFinder is a web app that I truly encourage patients and healthcare providers to register for because it is truly a time saver. So now I'd like to change gears a bit. We spent a good amount of time talking about the safety net for individuals who are underinsured. I want to talk a little bit about advocacy because at PAN, we believe that everyone should have access to the needed care that they deserve. And we work very hard to advocate for that improved access. We do that in many, many ways. We do that through education. We do that through meetings with members of Congress and their staff. We do a lot of this work on our own, but we also work in concert with many other patient groups and alliances. We have what's called position statements that at PAN are board-approved position statements that speak to the issues that we advocate for. And we go through a rigorous process every year to kind of look at the policy landscape and decide where we need to spend a little bit of attention. And there's a lot of areas that need attention. We have spent, for example, over the last decade, we've spent a lot of time advocating for the Medicare reforms that were included in the Inflation Reduction Act. And I'm going to go over a couple of them in a moment. But we also advocate for ensuring that patients are not subject to harmful programs, harmful policies that the health plans are instituting. And some of you may be familiar with things like copay accumulators and a new trend called alternative funding programs. These are programs that are limiting access to needed specialty medications for people with chronic diseases. So, you see here just a handful of the items that we advocate for. And, at the end of the day, as I said, we believe everyone should have access to the care we need. And we want to make sure that whatever policy is put forth, it's patient-centric and it's designed to have the lowest out-of-pocket costs for patients, or no out-of-pocket costs. So with all of our work in the Medicare reform area, we have set up an education hub on our website, and you can visit it on your own time. But we have a lot of information there about the reforms that were included in the Inflation Reduction Act, some of which have already been implemented and some are coming in the matter of a couple of months. And I'll review that in a moment. And we also have set up a hub to talk about some of these harmful programs and policies that health plans have instituted over the last few years that are truly limiting access to needed care by patients. So just a moment on the Medicare Part D reforms. I think it's so important to devote a few minutes to this because as I do a lot of speaking to patients and to healthcare providers, what I'm finding is that there's generally fairly low awareness about the Medicare Part D reforms that have already been implemented and will be implemented. So in the Inflation Reduction Act, which passed now a little bit more than a year ago, there were 6 reforms relating to Medicare Part D. And as you know, Medicare is for people who are over 65 or on disability. So January 1st, 2023, there were 2 reforms that went into effect. One is for people on Medicare. When they need vaccines, they won't incur any copays relating to these vaccines. The second very important reform for people on Medicare was the insulin copay cap of $35 a month. Very important reform. In a matter of a couple of months, January 1 of 2024, there's 2 more reforms that are going into effect. And then in 2025, the final 2. And I'll explain all of this as succinctly as I possibly can, because it's all a little bit complicated. So some of you may be familiar with the federal Extra Help program. It's also called the Low Income Subsidy Program. This is a program that has generally been for people up to 135 or 150% of the federal poverty level, so very low income. To be eligible for this program, there are income requirements, and there's also resource or asset requirements. Up to this point, there have been 2 programs offered by the Social Security Administration. One is the Full Benefits Program, which is for people up to 135% of the federal poverty level. And the other is the Partial Program for those who fall in between 135 and 150. The beauty of this program, and this is a program that very few people know about, is up until now, if you benefit for the full benefit program, most, if not all, of your out-of-pocket costs for prescription medications will be covered. So what the Inflation Reduction Act has done, and this will go into effect January 1st, 2024, it eliminates the partial program, which was just not as generous as the full program. So now people up to 150% of the federal poverty level, presuming they meet other eligibility criteria, will benefit from the Extra Help program and will have most, if not all, of their out-of-pocket costs covered. We estimate that conservatively, maybe 400,000 more people across the United States will benefit from this reform. So don't get scared by this graphic. I'm going to walk you through it. This explains how out-of-pocket costs for people on Medicare Part D will start to come down beginning in a couple of months. And really the color that I want you to focus on is that dark blue. That's the enrollees. It's the patients. So some of you may know that currently the Medicare Part D benefit design is very, very complicated. Once an individual has spent around $3,100 out of pocket for their prescription medications, and unfortunately, that's for many a very easy threshold to meet, because out-of-pocket costs for specialty medications can be quite high. But once they have spent $3,100, they are now obligated to spend 5% of that drug list price for the remainder of the year, and there is no limit. There has been no limit. So that is why it's unfortunately very common for people on Medicare to be spending $5,000, $10,000, $15,000 out of pocket for their prescription medications. Why affordability has been such a problem. But this starts changing in 2024. What the Inflation Reduction Act did was they eliminated that 5%. And so now in 2024, someone on Medicare Part D, once they have spent, it goes up a little bit to $3,250. That will be their cap. They will not spend any more than that amount over that calendar year. The real benefit comes in 2025 for people on Medicare Part D. In 2025, there will be a hard cap of $2,000. So no one will spend more than $2,000 in out-of-pocket costs for their prescription medications. So that is a step in the right direction. Now, we know at PAN, we know that all of you know, $2,000 is still a lot of money for many people. It is. But it is an improvement for many who are used to spending much higher than that amount. The other reform that goes into effect in 2025 is that the health plans are now required to offer a program to their enrollees that allows those enrollees to what we call smooth out their expenses. So if you have been a Medicare beneficiary or know of someone who is, January has traditionally been a very difficult time for them when their deductibles reset. So now what this reform offers is the ability to smooth out those costs. So if, for example, you believe that you're going to spend $2,000, which is your cap, those costs can be more evenly smoothed out from January through December. Now, as I said, we know that $2,000 is still a lot of money. We actually did a poll about a year ago to ask adults what they thought about $2,000, and 3 out of 4 adults said it's going to still be a problem. It's still unaffordable for me. And when we looked deeper into the adults who responded to our survey, that sentiment was especially strong among Black adults, Hispanic adults, people who have very low income, and people who are living with a chronic or rare disease or multiple chronic and rare diseases. And we actually commissioned some research from Avalier, which is a leading research company, to just validate our belief that even with the reform, millions of people are still going to have spending levels up to that amount. So again, the reforms are good steps, but we believe that PAN and the other charitable foundations will still be needed to provide that financial assistance to those where, $2,000 is still going to be a hardship. Just a moment on our commitment to health equity. As I mentioned at the top of the webinar, we believe everyone deserves equitable access to affordable health care, regardless of who they are. So, how do we accomplish this commitment? By providing financial assistance to the people who need it the most. We partner with organizations that have a similar commitment to health equity, and we advocate for policies that promote health equity. So, for example, one policy and position that we advocate for is making sure that as we think about clinical trials, we're thinking about making sure that there are diverse populations that are included in clinical trials. So we accomplish our health equity commitment in a number of ways, but just bringing your attention to that third and fourth bullet, we believe one of the best ways we can work toward this with others is by partnering with other organizations. So we have formed partnerships with groups like the National Rural Health Association, because we know that access to care is especially problematic for people living in rural communities, or by working with providers such as Hispanic nurses or Black nurses. You know, as a rule, when we look at the healthcare provider community, the nurses and the social workers and the navigators are really important healthcare provider groups for us, because they are on the front lines educating patients around patient assistance and helping them search for the financial assistance that they need. So that we come to the end of the webinar. I really encourage you to connect with us on social media. You see all of our handles here. And I know, you know, I provided these slides to Jerry and his team. So hopefully, if they think it's a good idea, these slides are definitely can be made available to all of you, because I know I shared a lot of information in many, many slides. We hope that you'll stay connected and learn about our programs. You have the QR code here, and we also do a lot with advocacy. So we encourage you here to sign up for our advocacy newsletters, sign up for our advocacy alerts. They are great ways to learn about policy solutions that have been put forth, learn about ways that you as an individual can participate in advocating for improved policy solutions, for example, through grassroots campaigns that we have directly on our website, where with a click of a button, you can send a message to a member of Congress.
Thank you so much, Amy. If you'll close your presentation, we'll send the slides out to everyone. And then if Casey can facilitate the questions and answers.
Great. Thanks so much, Amy.
Sure.
I think that the big question that we see here in the chat is, when someone needs to be on, quote, treatment, what do you mean by treatment? Is it strictly an infusion therapy, or does that include things like kidneys or heart medications?
So the medications that we cover include those that are on the Part D as in David program, as well as Part B as in boy. And I think the infusions are where Part B comes in. When we look at our patient population, most of the assistance that we're providing is in the Part D as in David program. But again, I encourage everyone to go directly to our website and look at the covered medications that we list for every single disease program.
And to be eligible for PAN services and be on treatment, is it any treatment in Part D, or is it only for infusions?
The eligibility criteria would be that you are diagnosed, for example, with Fabry disease, and that the medication you are seeking is on our formulary, which means that it is an FDA-approved medication.
And one of our participants has been a PAN Foundation recipient for a while, but recently went off their primary Fabry medication to be part of a clinical trial. Does that mean that because she's not on one of those treatments, that she would no longer be eligible for something like insurance premiums?
If the treatment is not FDA approved, it will not be on our formulary. The only caveat is if we have included an indication that is in published guidelines.
Okay.
And a lot of that is, we find that mostly in our oncology disease funds, but maybe not exclusively.
And then when individuals with Fabry go to a clinic and get their infusions, and their hospital has a facility fee or a copay, are those types of additional fees covered under the PAN Foundation programs?
I wish I could say yes, but it's not.
Okay.
Right now, we are only providing assistance for the medications.
Okay.
Yeah.
All right. Any other questions? Okay, well, thank you so much for your presentation. We're going to send the slides out, and
Great.
we'll put your slide deck on our website also, if that's okay.
That's perfectly fine. Thank you so much. It was a pleasure to speak with all of you, and take care of yourselves.
And you also. Thanks, Amy.
Thank
All
you.
right, now
Bye-bye.
for the prize drawing. So if you would put Pan in the chat, we'll do the prize drawing for people with Fabry, caregivers, and family members first. So if you're one of those and you put Pan in the chat box, Brittany will give you a minute, and Brittany will collect those responses and tell me how many there are. And I have my random number generator ready on my phone.
And not quite yet, but in a second, Jerry's going to talk to you about people who have completed our PROS survey, our patient recorded outcome survey.
Yes,
If you
we
have
already
not
know.
already, it is still open through the end of the year.
Okay, so we have I don't know if I can see them all, but how many are there, Brittany? Is everyone should have the pen in the chat box by now? We have
11, I believe. Oh, 12. That's
12.
everybody.
All right. My random number generator is going to pick one number out of 12. And the number is number 11. Congratulations. We're going to get $50 to you. And the second drawing, or sorry, yeah, $50. And the second one for anyone that has either already taken our December 2022 patient reported outcome survey, or we'll get it done in the next 2 days. You can enter well, actually this time enter
PROS.
enter PROS, yes, PROS. And that stands for Patient Reported Outcome Survey. Stephen, congratulations on the second $50 prize drawing. So again, thank you all for being here. We're going to do this for the TAF, the Assistance Fund, and then Assessia, formerly PSI, and then the American Kidney Fund. So in the next 6 weeks or so, we'll have 3 more of those, and then we'll start on a series of mental health webinars.